So hello everyone and welcome to this Osce session, and today we'll be discussing case 4. So here we have a 25-year-old male who presents with complaints of abdominal pain, anemia, chronic history of diarrhea and weight loss since the past 2 years now. And I have provided you with the CT scan sections of this patient. These are the axial post-contrast images. These are the non-contrast images, axial section, and this is the coronal section, post-contrast. So based on these images, what is the diagnosis and what are the findings that are appreciated? And what is one associated syndrome that you can think of with this disease and a complication of this disease? So this is a non-contrast axial section through the upper abdomen. What can be appreciated here? Give you some time to appreciate the findings in these images. So in these non-contrast images, what we can see is the spleen. The spleen is very small. It's an atrophic spleen. This is post-contrast images, axial section of the abdomen, where we can see that this large peripherally enhancing cavitations with some fat fluid level seen. These are actually mesenteric nodes, large cavitating mesenteric nodes with fat fluid level that are seen here. Splenic atrophy, large cavitating mesenteric nodes with fat fluid levels. Here we have to appreciate the bowel here. The ileum here should be featureless. That is the characteristic of ileum. But here the ileum has many folds. So based on these findings, that is splenic atrophy, large cavitating mesenteric nodes with fat fluid level, and jejunization of the ileum. What do you think the diagnosis is? So, fat fluid density in multiple enlarged mesenteric nodes, splenic atrophy, and jejuno-ileal reversal. The diagnosis is actually celiac disease, and this is called a cavitating mesenteric lymph node syndrome, which is characterized by the triad of splenic atrophy, low attenuation lymphadenopathy that contains fat fluid levels, and villus atrophy. So what exactly is celiac disease? Celiac disease or non-tropical sprue is the most common gluten-related disorder, and it's actually a T-cell mediated autoimmune chronic gluten intolerance condition, which is characterized by loss of villi in the proximal small bowel and GI malabsorption. The jejuno-ileal fold pattern reversal, that is jejunization of the ileum, is one of the signs of celiac disease, which is very well appreciated on CT and as well as MRI. The pattern is one of the increased number of ileal folds, which were seen very well on those images, along with reduced number of jejunal folds, and is considered positive when there is more ileal than jejunal folds over a 5 centimeter distance. So this is very characteristically seen in celiac disease. So coming to a syndrome that is associated with celiac disease, so this actually is a spotter. So in this axial section of brain, we can see that there is dense calcification in bilateral occipital lobes that is seen. So what is this syndrome? It's called Gobay syndrome, also called CEC, that is celiac disease, epilepsy, and calcifications in the occipital region. So one complication of celiac disease is small bowel lymphoma, especially the enteropathy associated T cell lymphoma, and one association is CEC syndrome, that is Gobay syndrome, that refers to combination of celiac disease, epilepsy, and bilateral occipital calcifications.